Hi, my name is Grace Reese. I'm a 7th semester nursing student, and I will be filming part 2 of the nursing skill providing trach care. We're assuming that I have just finished sectioning, that my patient has been verified and assessed and tolerated the sectioning well, and now I will proceed with cleaning the inner cannula, the wound, and providing a fresh dressing around it. So I've already removed my old dressing during part 1. And my next step will be to open my tracheostomy care kit before I am sterile. I will perform hand hygiene and I will don sterile gloves. Now that I am sterile, I will establish a sterile field. In my kit, I have some swabs, a fresh bandage, hydrogen peroxide and a little scrub brush, a fresh trach bandage, some gauze, normal saline, and an extra container. I'll divide the normal saline between 3 compartments and discard. I will open my saline and pour into 1 compartment and discard. Next, using my non-dominant hand, I will remove the inner cannula for Mrs. Jones and place it in the solution with the hydrogen peroxide and normal saline. Holding it with my non-dominant hand, my dominant hand I grab the brush with and scrub it thoroughly, and then place in normal saline and discard my brush. Now that it is sterile, I'm sorry, it's not sterile. Now that it's clean, I will grab with my non-dominant hand and insert my next step is to clean around the incision. With my dominant hand, I take swabs, dip them in normal saline, one at a time, clean thoroughly around, and discard, using each one only one time. At this point, I would have an assistant holding the tracheostomy in place. I'm also going to take some gauze soaked in normal saline, or I could also use hydrogen peroxide if there are a lot of crusty secretions. And I'm going to thoroughly clean. We're discarding. Next, I want to dry. Dry gauze, I'm cleaning around and discarding. My assistant is holding the tracheostomy in place, and I am now breaking sterility and removing my old bandage and discarding. At this point, I replace my sterile gloves with new sterile gloves, which I will not be doing for this video. With my new sterile gloves, I take my sterile dressing, and I'm also going to use a cotton-tipped applicator to help me. I'm going to use the cotton-tipped applicator to help push the dressing underneath the trach collar to prevent skin breakdown and to allow me to maintain sterility. My last step is to take the trach collar, the new trach collar, while my assistant is holding. Have the client lean forward if they can. and refasten, making sure that there is no rolling or rubbing under the skin. I should be able to fit 2 fingers comfortably in between the dressing and Mrs. Jones' skin to make sure that it's not too tight. I'm now going to assess Mrs. Jones. I want to know how she tolerated the procedure, any kinds of secretions I saw during it. I want to know her oxygen saturations now to make sure that she's not desaturating on me. I'm also going to want to document what type of trach she has if that's not already listed. Thank you.